On. Oh, yeah, there we go.
Quadcast Nation, we have a special guest, Dr. Emma Paul. I knew it, Pollon-MacLeod.
Yeah, that's okay.
Okay. Quadcast Nation, we have a very special guest today. We have Dr. Emma Pollon-MacLeod, naturopathic. Okay. It's been one of those days. Okay, here we go. Quadcast Nation, we have a very special guest today. We have Dr. Emma Pollon-MacLeod, naturopathic doctor, CEO of NutriChem, and today we are going to talk all things women's health, menopause, perimenopause, because for many people, as you know, Emma, this is a black box. So welcome to the show.
Thank you for having me. This is awesome.
And Emma, we got to also give a quick plug before we even get started. We're doing a massive event October 25th on perimenopausal health,
Yes.
which is, I'm so glad to be partnering with you guys. This is going to be great.
Oh, I'm so excited. I feel like the first time we connected, we were like, we have to do an event together.
Oh, man.
Yeah.
And the first time we met, I think it was a few years ago, but instantaneously, I've just felt a great connection because you are going the extra mile for your patients, and it's what we need to see in healthcare. So let me start with, like, where did you get this interest to be focused on perimenopausal health, menopausal health? Like, where did this generate from?
Well, it actually started with NutriChem. So we've been around for 45 years this spring, and my dad started it. And, it's a compounding pharmacy. So he got into the realm of hormones, 15, 20 years ago. They hosted an event, and they actually brought Suzanne Summers to Ottawa.
Really?
Yeah, so to kind of start initiating the conversation around hormones for women's health. And, growing up, I was in high school, university, I always worked. It's a family business, so you work in the business and exposed to so many women who were like, this is life-changing, no one's speaking about it. So I kind of had this like secret view of women's health and hormones, and from such a young age. And I saw my mom talking about it. So I kind of grew up around women's health and hormones, so it feels very aligned that now this is really kind of the area of focus that I have in my practice, and NutriChem is really kind of like pushing forward.
This is great because as we have appreciated, too many women have suffered over the years because of a lack of options, a lack of treatment options. So what are some of the misconceptions that you have seen when the women come to you for advice or for treatment?
Well, one of the biggest ones that I see is just the unawareness that it actually is hormones. I think sometimes we hear and we see in textbooks that, it's supposed to be this super obvious, oh, I have hot flashes and night sweats and my periods are stopping. And it's so obvious. Whereas in clinical settings, so many times women are, seriously concerned that there is a really serious health problem going on that no one can address. They think that they're like going through early onset Alzheimer's. They think that they are going through, serious metabolic issues. And these are issues, but we just aren't talking that this is the trajectory of what can happen to women in these kind of critical years. And so that's kind of the biggest thing, that it's not so easy to identify. And sometimes it's so much more intense than women are led to believe.
This is a good point, right? Like, there was a lot of women that were started on antidepressants. They were started on many medications because of these hormone imbalances, their perimenopausal symptoms. And the awareness back then certainly wasn't the way it's becoming now, which I think is one of the main benefits of you and I having this conversation now, and to increase that awareness. I'm curious, in your practice, how do you make these assessments? Is it mostly you interview your patients? Is it scorecards? Like, how do you get a sense from a patient that, hey, you might be going through perimenopause?
Yeah, that's a really good question. And we have, our initial intakes, we have a full hour to sit down with people and get into the nitty gritty of what is actually going on. And so, a big part of identifying the stage in which a woman is at is understanding their menstrual cycle, and if there's any changes to their cycle. Understanding, of course, where they are, like when their mom went through menopause is a big factor as well. Understanding, what age they're at and when they first got their period, but also their symptoms, because hormones and hormone replacement therapy is a tool for quality of life and symptom relief. Yes, there's additional benefits, but we're really trying to identify, we know that sleep is probably one of the number one things that starts to come up. Mood dysregulation, irritability, like severe anxiety, heart palpitations, changes in body composition, brain fog, energy drops. So we always ask about, starting to understand how this is impacting, that woman's life. And oftentimes there's pieces that aren't related to hormones that are results. So, crazy heavy periods that can happen when the period is changing will lead to more severe iron deficiencies, which can further deplete energy levels. And, a changing body composition, we often see women start to really significantly decrease their calories and protein and start exercising more. So then they feel weak and shaky and they're tired and exhausted all the time, but they're not losing weight. So there's a lot of kind of downstream things that happen that we try to accommodate for or that are impacted because we don't understand this is happening.
I would imagine, too, during that hour-long visit, it's got to be so, I don't know, like so validating for the patient, because they're going through all this crap, and I'd imagine a lot of them were lost. It's got to be like an emotional toll on top of just what they're going through physically.
Oh, absolutely. And a lot of the times a lot of women come out just trying so hard to convince us that the symptoms are real. And I'm like, oh, I believe you. You don't need to say that it's this serious, and I think that's often we're taught that in order for us to seek health, something has to be so intensely dysregulated to try to get support. And the whole narrative is that you don't need to wait until you're at that level. You can still need support even if you start to see patterns happening. So yeah, a lot of women feel incredibly validated. Some women who haven't heard anything around hormones almost can sometimes feel like, how can this only be hormones? How can I, like, why? And, and it's kind of like, that's why there's so much momentum, because they're like, why aren't we talking about this? This is wild. And that's why that's why we're here.
100%. I like what you said about not waiting till it's not too far gone, but really far gone. You know what I mean? Like, I think this is another important part of having these conversations, is that when these symptoms start to come on, like I'll speak openly about this. I've seen my wife go through this, and we were not ones to, forgive me, Kathy, but we weren't ones to seek help early. I would not. There was some rough times. But this is yet another component, like, why wait to suffer? It's along the lines of prevention over prescription. Like, we want you to address your needs earlier so that you don't become depressed, whether you're questioning whether you need to be on antidepressants. We don't want you to be so sleep deprived and exhausted that you lose yourself. So I think that's a really fair point, Emma.
Yeah.
Yeah. So maybe this might be part of the juicy part of the conversation. Hormones 101. Like, what you hear about, I don't know, these different type of hormones, are they bioidentical, whatever that means. Some people, you're hearing about estrogen, progesterone, testosterone, all these things. So what at a high level are the options, and what are the benefits of them?
Yes, I love this question, because sometimes it can feel so scary and overwhelming that, people can shy away from the hormone discussion. And I do think that's actually a big, before we get into it, a big reason behind women waiting so long is that it feels like this scary thing that for some people they don't want to kind of like have to start because they don't really know what it entails. And, with hormones, there is what we call a window of opportunity. And we were taught, back in the day that you only needed them in the absolute worst case scenarios. And now we know with all the research, you don't have to wait until you haven't had a period for a year. That bringing hormones in earlier can actually provide massive amounts of benefit, and it's actually safer. So when we talk about hormones and we say hormones and bringing in hormones, when we talk about women, we're talking mostly about estrogen and progesterone. Yes, there's testosterone, but these are the main ones. And we talk about hormone replacement. It really mostly is talking about estrogen, replacing estrogen. And I always like to talk about why we would even consider that. And menopause is the transition, the brain ovarian connection changing, right? Because our ovaries, as we age, they become less responsive, right? And that is natural. We have a finite amount of eggs or follicles, and so those decline with age. And so the responsiveness of them to the brain chemicals also declines. So as your ovaries are responding less and you're having less follicles become stimulated, your brain must send more and more signal to kind of get ovulation to occur. And so what can happen is you can have these big, massive pockets of estrogen that go really high and low. And so eventually when the signal kind of stops and ovulation isn't happening, a woman's not producing estrogen in higher levels anymore. And that not only has impacts in the transition on mood and sleep and body temperature, but also on bones, cardiovascular health, brain health, like a lot of the really critical systems that we want to make sure are protected with the use of estrogen. And so when you hear the word bioidentical, that buzzword, it means it's the same type of estrogen that's in your body. So if we gave it to you, we could test it in the blood and see those levels increase. We could see your estradiol. So we're talking about estradiol. And there's a lot of commercially available hormones now. Most people are prescribing estradiol, like bioidentical estrogen. It's quite rare to see people prescribing non-bioidentical anymore. Birth control is synthetic estrogen. So when we talk about estrogen, there's patches, there's gels, there's creams. So there's mostly topical forms. There are also oral estrogens. The topical forms, they bypass the liver, so they have a way better safety profile. So oftentimes we want women on a topical form of estrogen, and you must protect the uterine lining. So if you're going to give a woman estrogen, you must also give her progesterone as well. And progesterone itself has a lot of benefits. And again, with more research coming out, the best form is the micronized. So it's an oral ovule of progesterone, and that's often taken in the evening before bed, and it's really beneficial for sleep, anxiety, heart palpitations, and it can be helpful for hot flashes as well.
So almost always it sounds like, Emma, you're going to take both. You're going to take estrogen and progesterone.
Yeah, and when you initiate those is different. Progesterone is often the one you would initiate and start with. Often in perimenopause, it's that estrogen to progesterone gap that creates a lot of problems with sleep, mood regulation, and initiating progesterone at that point can really provide a lot of symptom benefit, specifically for sleep, nighttime anxiety, the like waking up at 2, 3 in the morning, kind of feeling that pressure on the chest, a lot of that physical anxiety. Progesterone can be incredible for that while your body is kind of working its way through the estrogen ups and downs. Once you start to transition into late perimenopause and your period, you start skipping periods, that's when you can bring in a little bit of estrogen That's how we practice, gentle, slow, low, listening to the woman, making sure, they are actually getting benefit. So you do want to go, you do want to make sure you're tailoring it and listening to each woman and understanding how they're responding.
And based on that, then what's the value in doing blood work for assessing what their hormone levels are or where they're at in terms of treatment options?
Oh, that's a great question. Blood work is quite controversial for perimenopause because the nature of perimenopause is that your hormones are going to be fluctuating. So there's a couple of situations where blood work is very beneficial. So if a woman has had a uterine hysterectomy, so she still has her ovaries, but she has no uterus, so there's no bleeding. So we have no idea how far along she might be, or if she has an IUD, or if there's been an ablation. So something where there's no actual period change to be able to inform us, is this woman in early stage peri, or is she like in full blown menopause? We actually don't know unless we get a couple consecutive FSH readings. So there's that benefit. There can still be benefit if you catch a elevation in a couple markers that can really help show us that they are farther along than we thought. But catching normal readings doesn't negate, we wouldn't really change our treatment.
Okay. Yeah, that was my understanding as well in terms of, not only is there going to be fluctuations, but it's also personalized. Like what one level might mean to you, like for you, might be different for another woman. So I think pairing it with symptoms, as you alluded to there, is like a must.
Oh, absolutely.
Yeah.
It is a must. But there is, I do say, like, there is value in doing an initial and doing a little bit of blood work, because there has been times where, again, the symptoms are telling us, okay, this woman is probably in very early stage perimenopause, she's still having a regular period. And then when we run an estrogen and FSH, her FSH is at a 20 and her estrogen's at less, like in a menopause level. It doesn't mean it's not going to flip back on the next cycle, but it means, okay, you're getting those low levels. Like your body is farther into this process than we might have anticipated if we didn't.
Yeah. Thank you for that. The other component to all this is, if we look at why women weren't being offered hormone replacement therapy in the last 20 years, it's based on WHI studies. And what's your interpretation? When people bring this up, like if I'm going to take hormones, I'm going to be at risk of getting cancer. Like, how do you address that with your folks?
Yeah, that's a really important thing to address, because if women don't feel safe in what they're taking and they just feel dismissed, like, oh, it's fine. Again, the compliance is a problem, and you should always be able to ask these questions. So we know that with, dissecting this study up and down and left and right, the Women's Health Initiative, the average age of women was 65 in that study. It was primarily, it was looking at a lot of cardiovascular outcomes. The big part of what we saw with that, it was the synthetic progestins that played more of a role in the increased risk of breast cancer. The breast tissue is responsive to hormones, so there is this very slight increased risk if you are using hormones, especially on breast density, which can drop the ability on screening to identify a breast cancer. But the risk is lower, and people don't know that. The risk in using hormones is lower than alcohol consumption, not exercising regularly, being overweight. So there is, you must look at the entire environment in which we are putting, hormones in your body. So I often say the risk has been way over exaggerated and created so much fear, and women not having access to a therapy that can provide such an incredible, such a huge benefit. And they're leaning on things that increase their risk, like wine, to sleep. and for the anxiety, and then they're not moving because they're too exhausted. So I'm like, at what cost?
And also, the opportunity cost, but also the trade-off of reducing your cardiovascular risk and your bone osteoporosis and frailty, like all these things that we know also have a scary mortality risk. So I think having that discussion, looking at the cost benefit is so important, but absolutely not being very black and white and putting people in a box, because it really needs to be personalized, in my opinion.
Oh, yeah, absolutely. And you do see, where if we can go the other way where we give everyone hormones, and again, they're not sure how to use them, when to use them, it's a little late. So really making sure we're having these conversations early with women. We're talking about the loss of bone that happens rapidly when you lose your estrogen, right? Like, we know it's in the first 2 to 5 years post-menopause is the biggest loss. Same with your cardiovascular health. Bringing hormones in earlier can really create such a better pathway to longevity and better health. And so, this is why I love talking about this, because women need to know this.
Yeah, it's empowering.
Yeah.
And as you said, not everybody needs to be on treatment, but knowing what your options are, being educated and knowing that down the road it is an option, or maybe even knowing the risk, you're incorporating some of the lifestyle measures earlier on, like weight training, like protein, focusing on protein, like all the easier stuff.
Yeah.
But yeah, like it's. I think to me, this is like education is power.
It is power, and every woman has the right to understand her body and understand her options and understand the risks. You do what you will with that information, and you can make whatever choice you want, but it's not a choice somebody else should make for you, which is
Right.
what we see a lot, where someone's has an interaction and they're like, oh yeah, don't even consider that, and they give them misinformation, and now we've closed the door on something that maybe this woman would have hugely benefited from, or actually been open to, but she was never given the opportunity to even have that conversation.
Absolutely. So such good points. What about, just to close the loop on the hormone side? What about testosterone? When do you think about offering that to patients?
So testosterone's a little bit different for naturopathic doctors because we can't prescribe testosterone.
Oh, I didn't know.
So there's a large area, especially for testosterone, around libido, performance, muscle mass, that sort of thing. Oftentimes when we're not getting the benefit that we need through estrogen and progesterone and all the other pieces, like the protein, creatine, nutrients, iron, like those are really the building blocks for, making all your testosterone, right? You're still making it from your adrenal glands when you sleep at night. So improving sleep, improving energy to build that muscle to drive testosterone is the way that, most of the time it works. And then otherwise I help kind of coach them to refer to someone who can prescribe. But it's actually not a large part of my practice for women, at least.
Mm-hmm. Well, Emma, how do people learn more about what you're doing, what you have to offer? Because once again, in my opinion, it's hard to find help when it comes to perimenopausal health, and your knowledge, the fact that you're helping so many women in our community, I think is amazing. But how do people track you down?
Where am I not right
Where
now?
are you? Yeah, fair enough.
Well, one of the things that it's really important to look for a Menopause Society certified practitioner. So that's MSCP, just because they've done additional training, and we do have a standard of care for understanding conversations on risk and evidence and that sort of thing. So there is a standard now for practitioners who want to be in the hormone field. So I strongly suggest looking for that credential. come see us at our event on October 25th. I'll be there speaking. But at NutriChem, right, we've been around the city forever. So we're at Carling and Richmond. You can come by. We've got the clinic, nutrichem.com. You can email the clinic. We've got 4 NDs that have their Menopause Society certifications as well. So that's really the area of focus that our clinic is really honing in on. So anything NutriChem, Instagram, LinkedIn, come by and chat with us. We love talking about this.
And I've personally made a visit a couple months ago, and it is an enterprise. You guys are doing great work. They got great books as well. And the team has been incredible. I know I got to meet your sister as an example.
Yeah.
She's getting married soon. Good luck. But Emma, this has been an absolute gem. And I really appreciate, as I said, all the work you're doing for the community, empowering women, and you're just fun. It's fun. It's fun to be able to chat with you and to collaborate, and I really appreciate you taking the time.
Oh, absolutely. Thank you for having me. I've been a huge follower of your podcast for a long time, so it's really special for me to be on here with you.
Oh, thank you. So that's it, Quadcast Nation. You know where to find us: Instagram, YouTube, TikTok, Facebook at Quadcast. Check out Guide to Nutrition. We got Quadcast 15 for 15% off all products. You know the book, Prevention Over Prescription. I can't believe you haven't got that bad boy yet. You could go to drkwadwo.ca to find out all the information there. And our event, Thriving Through Menopause, October 25th. Link is in the show notes, or go to drkwadwo.ca to find out more. But it's time to It's time to, well, how am I ending this? It's time for all of us to make a difference. So thank you for listening, and we'll talk again real soon.
We just
Perfect. 26 minutes. Just press stop.
Yeah.